Imagine receiving a medical bill that is far higher than you expected, turning a routine visit into a financial headache. Many people face this stress, often wondering why their healthcare costs suddenly jumped. Understanding a key part of your Medicare plan can help you avoid these surprises. Your provider network significantly affects your Medicare bills by determining how much you pay out of pocket for services. Generally, staying within your plan's network for care will lead to lower costs because these providers have an agreement with your Medicare plan regarding service charges. When you go outside the network, your costs can increase substantially, sometimes leaving you responsible for a much larger portion, or even the full amount, of the bill. The core mechanism here involves contracted rates. For most Medicare Advantage plans, which are Medicare Part C plans offered by private insurance companies, providers in the network have agreed to accept specific negotiated prices for services. Your plan then pays its share, and you pay your copayment, co-insurance, or deductible, all based on these agreed-upon rates. If you see an out-of-network provider, that provider might not have such an agreement. They can charge higher fees, and your plan may pay a much smaller percentage, or nothing at all, for out-of-network care. For Original Medicare, which is Medicare Parts A and B, providers who accept assignment agree to Medicare's approved amount for a service. This means they cannot balance bill you for the difference between their charge and Medicare's approved amount. If a provider does not accept assignment, they can charge up to 15% more than the Medicare approved amount, which is known as excess charges, and you are responsible for paying this difference. So what can you do? Always verify that your doctor, hospital, or other healthcare provider is in your plan's network before you receive care. If you have a Medicare Advantage plan, check your plan's provider directory, which is usually available online or by calling member services. For Original Medicare, ask the provider's office directly if they accept assignment for all services you plan to receive. This simple step can prevent unexpected charges. It is also wise to understand your specific plan's rules regarding referrals, especially if you have a health maintenance organization plan, as seeing a specialist without a primary care physician referral could also lead to higher costs. A key term to remember is balance billing. This occurs when a healthcare provider bills you for the difference between what they charge and what your insurance plan pays. In-network providers generally cannot balance bill you, protecting you from these extra costs. However, out-of-network providers, particularly with Medicare Advantage plans, might be able to balance bill you or simply not be covered at all. Another important concept for Original Medicare beneficiaries is accepting assignment. When a doctor accepts assignment, they agree to Medicare's payment amount as full payment, helping you manage your out-of-pocket expenses and avoid those 15% excess charges. Taking a few moments to understand your Medicare plan's network rules and confirm your providers are in network or accept assignment empowers you to make informed healthcare decisions. This proactive approach ensures you receive the care you need without the stress of unexpected bills, keeping your healthcare costs predictable and giving you greater peace of mind. It is a smart way to protect your budget and focus on your health.